Good evening, everyone. And I think today's topic is interesting, and it's by no way a new topic, neither for Lebanese medical students or for even females. And we'll see in a bit why orthopedics is so competitive. And we'll talk about females in orthopedics. So I want to just start with a bit of an interactive discussion. So I'll show a bit of a couple of images, and we'll see if you recognize these ladies. So we're not only going to talk about how to apply, because I saw a few of the sample questions that you sent to the group, and most of them were about if I see that there is a future for female orthopedics in Lebanon, and how is it hard to apply, and what can you do to apply? But the main concern is there a future for an orthopedic female surgeon in Lebanon? Yes or no? So does anyone have any idea about who this lady is? Anyone? You can raise your hand or just speak out her name, or if you don't recognize her at all. So anyone has any idea? So, all right, doesn't look like it. So if being in black and white, so this is supposed to be a very old image. So this is from 1937, and the name is Ruth Jackson. If any one of you wants to do orthopedics, you need to really know her name, because one, there's a group in her name in the States, and it's one of the most active female orthopedic surgeon groups. It's very powerful. It's AWS, but it's more towards orthopedics. And Ruth Jackson was the first female in 1937 to be a member of the AAOS, that means the American Academy of Orthopedic Surgeons. So in 1937, she was the first. Anyone knows who this lady is? So anyone of you interested in doing orthopedics? Well, if you've been interested in orthopedics in the last 2 years, you should be able to recognize her and recognize the logo next to her. So that's the logo of the American Academy of Orthopedic Surgeons. And so American Academy is one of the biggest international groups of orthopedic surgery. It's one of the most powerful in the US. It has among its members most of the orthopedic surgeons in the US. And this lady is Christy Weber. So Christy Weber became the first female president of the AAOS. And that was in 2019. So it took kind of a long time, all right? At least 80 plus years for a female to become the president after the first female became a member. Anya Abu Khalil. Okay, so Christy Weber became the first female president nearly 80 plus years after the first member. And one of the main goals for Christy Weber was to tackle the important disparity in numbers between females and males in the orthopedic surgery in the US. So around 94% or a bit less, a bit more, depending on the states, is male in orthopedics. So just a quick word about why is it that orthopedics is very competitive, not only for females, but in general. So these are the top 5 paid surgeons, and by extent physicians, because all high-paid medical specialties are mainly surgery. Okay, invasive cardiac surgery, cardiology, and invasive gastro come around fifth or sixth. So neurosurgery is number one, with just below $1 million. Orthopedic surgery, spine is very close to that. And then pediatric neurosurgery, cardiothoracic surgery, and in fifth position, another orthopedic surgery, hip and joint surgery. So, and if you see the numbers, you see that in the top 5, there are 2 neurosurgeries and 2 orthopedic surgeries. And of course, the cardiothoracic. And among these 5, you don't see a very female-oriented surgery. So when you think female surgeons, number one, you still think in numbers, you would think of OBGYN, obstetrics and gynecology. You might think of pediatric surgery, even general surgery, but you don't think of female surgeons when you're thinking neurosurgery or orthopedics, because these are has the lowest numbers of female surgeons. Most is orthopedics. So the least numbers is in orthopedics, even less than neurosurgery and less than cardiothoracic surgery. And where are they getting paid the most? So in Canada, in Switzerland, Germany, and the US, orthopedic surgeons get paid more than $500,000 per year. Australia, France, and Netherlands, more than $350,000, below $500,000. So it's a very lucrative surgery, and it's a very demanding surgery. So how hard is it to get into orthopedics? In the US, so in the US, as far as the entire country, every 1 position in an orthopedic residency program, you get around 450 applicants. So it's as tough as it's gonna get. So 450 to 1 position. In Lebanon, despite being easier, so for a very small country, you have a lot of orthopedic residency programs for a small country. For example, in the US, Lebanon would be like a big city, and you would have at most 2 or 3 orthopedic programs, which would drain the entire county or state. So in Lebanon, you have a lot of residency programs. And despite all that, we'll talk in a bit on not only how many active orthopedic residents there are, but mainly on how many orthopedic applicants there is. So it is one very hard to apply to, whether for male or female, and it's harder for females to apply to, and we'll see in a bit why it is harder for a female to apply, even when she wants to apply. So women in orthopedics, if you think Lebanon has very low numbers of females, which is true, it's not very far from the US. So only 5% of active orthopedic surgeons in the US are females, okay? And that number didn't change much. So it wasn't like 1% 15 years ago and now 5%. And if you go into orthopedic surgeons, female, the numbers actually are way low if you're doing, for example, or hips and knee surgery. If you're doing spine, it's less than 1% for hips and knees and 1.5% for spinal surgery. The majority of orthopedic female surgeons, they kind of go towards finer surgeries. So they tend to go towards pediatric orthopedic surgery or hand orthopedic surgery. They don't usually go for the big limbs. In the US, the active residents, and these numbers are from 2018, the active residents are 14%, okay? So 14% of all residents are females, of orthopedic surgeons are females, which is the lowest of all specialties, okay? So even lower than cardiothoracic and neurosurgery. And it wasn't that lower more than 10 years before. So 2017, 2018, 14%. 2004, 2005 was only 11%. So despite having a female medical students number exponentially increasing. And this is not only in the US, but also in Lebanon. So I've been teaching at the medical school at the Lebanese University now for around 10 years, maybe. And I've seen the increase in numbers in female medical students. And despite that happening in the US, the number of female orthopedic residents only grew from 11 to 14%. And if you consider the entire medical residencies, so not only surgical, but surgical and non-surgical, the female orthopedic residents are less than 1%. And the more striking difference is that even for orthopedic females, surgeons, they get paid less than men, even if they are orthopedic surgeons. So if you think in orthopedic surgery, for example, the difference between women and men is around $40,000. In surgery, 32. In family medicine, the difference is not that big. So in all specialties, women tend to get less money than men. In orthopedics, that difference or disparity is one of the highest. So 40,000, around 11% of the money men make more than women. And there are a lot of reasons for that. One reason is that society. So in surgeons who get paid by volume, they get less patients than male, or they get less big surgeries, which are the most paying surgeries. Two, we're talking a bit about orthopedic surgeons in academia. So in the US, a big number of orthopedic surgeons are part of an academic program. So they are full-time faculty in orthopedic residency program. And females are the minority in that. So although you have 5% of surgeons who are female, the number of surgeons in a faculty program is also very little. And we'll see how that will impact the future of orthopedics and women. So where does the inequality start? So actually the inequality starts at the university. So as I was saying, the faculty percentage is only 8%. So only 8% of teachers are female. Now this is important. And here I'm talking about orthopedic residency faculty, female surgeons. And one of the most important kind of way that medical students are pushed or are directed towards a specialty is mentorship. If you talk to anyone who has ever applied, whether male or female, to one specialty, the majority will tell you that during their rotation or during medical school, one surgeon or one teacher or a mentor, they kind of gave them the push they needed, or the help, or the dream that they want to do the same as this person. And it would be easier if a female orthopedic surgeon taught, because that would give the female medical students hope that, yes, I want to be like her. And when you have this low numbers, and that would kind of discourage the female medical students into becoming female orthopedic surgeons, despite having a lot of male orthopedic surgeons who kind of encourage female students to become surgeons. It is still different than actually the student seeing someone of the same gender doing what she thinks of doing. And we're not only talking about faculty members, chairman, that means the chairman of the program, that means the head of the program. So the head of department, or the chairman of the department. We said that 8% are faculty. Do you know how many chairmen of orthopedic programs in the US, the entire US, is a female? One. And this current one, it's the first and the only female orthopedic surgeon as a chairman of an orthopedic program, and only one. So that number is astounding. And if you think that in the US, they are still at that era, at that way of thinking, no wonder in Lebanon, and Lebanon, by the way, compared to the Gulf, is good. Egypt, I have a lot of friends in Egypt. Actually, Egypt is better than us as far as numbers. There are a lot of females in orthopedic residency programs. When I mean a lot, I mean by numbers, but by percentage, it is similar to the ones in the US. Europe, the same thing. When I was in the States, probably back in the middle 2000s, every year had only one female resident. Okay, so in the 6 years of residency, they only had one female resident, and some years did not have any. So it is hard to get into a residency program, and harder for girls. So why do you think women don't want, or maybe think they can't work in orthopedics? One, let's say it's very competitive. So as I said, 450 apply to one. And assuming that from the 450, best case scenario, 50 are female. So by statistics, it's going to be harder for females to go in, even if you get the numbers to apply. Another thing is that usually females apply to residency programs in their mid-20s. So when you finish medical school around 24, 25, at that age, a lot of girls are already married, taking family. So a lot of these find it difficult to either in the residency program or later on balance between work and life. Surgery in general, and orthopedic surgery to be more exact, is one of the hardest, demanding residency program. And I'll explain to you why. So in orthopedics, you'll have surgeries, right? The same way you have in ENT, in brain, in neurosurgery and all that. And the number of surgeries that we do in orthopedics, practically in number, is equal to all other surgical specialties combined. For example, in a finger, so surgeries around a finger, you have around 35 for a finger, okay? And we operate from C1 down to the small phalanx in your toe. So every bone from here down, we operate on. Not only bones, we operate on muscles, on ligaments, on tendons. We operate on tumors, on degenerative pathology, on fractures. You operate on the spine, on the limbs, on the joints. So the amount of pathology that we treat is immense. And with this high number of surgeries, you'll get a high number of hours work. So when I mentioned salaries reaching $1 million a year, that's because most surgeons work more hours than anyone else. And for a resident, that's very demanding. For example, let me give you an example. In internship, so the first year of residency, so when we go, so residents, when you go visit the patient and round on the patient, start at 4:30 in the morning, 4:30 a.m. in order to start your day at 6 a.m. And surgeries usually start at 7:30 and do not end until late at night. And then you get the duty surgeries until the next day. So the amount of work on orthopedic program is substantial, okay? You rarely see your family, you rarely get a social life. And sometimes for a certain female, this is daunting, and this is daunting for men and women. And I know a lot of male students, when they do the rotation orthopedics, they get discouraged in order doing orthopedics because of the high load. Third reason why they think they can't, because there's a misconception, for my sake, it's a misconception, that orthopedics requires physical strength. So when you see a small petite girl, like 60 kilos or 70 kilos or 50, who is like 165, the average female height in Lebanon, they would think that, oh, how can she lift a leg or put a nail or do like a big thing? But that is not true. There's a saying that give me a lever arm and a stone and I can move the world, because it's all about how you apply your force. If you apply your force in a smart way, you don't need to be very big. The misconception is more pushed that the majority of orthopedic surgeons are big, tall, and muscular men. But that is because of mainly personality. So that's one of the other factors that I wanted to mention, is that what personality would succeed in orthopedics? And that has nothing to do with being male or female. That has something to do with the personality. So by surgeons, by definition, by experience as well, are type A personality people, because you need to be a leader, because in the operating room, you are the leader of that room. You need to be confident, because in surgery, unlike medicine, in medicine sometimes, but in surgery, a lot of the times, you need to make quick decisions for uneventful, unexpected things. You're operating and you nick the aorta. You're operating and you have a sudden unexpected. So you need to be confident and you need to react. Third, you need to be a hard worker. So that is the three, for me, the 3 points that you need to have in order to become a good doctor, a good surgeon, and of course, a good orthopedic surgeon. And the last thing that kind of discourages students in general, and females in particular, is that orthopedic does not require to be good in medicine. It is a kind of hammers and nails surgery. Orthopedics is very varied. You need to know pathology, you need to know infectious disease, you need to know molecular biology, you need to know biomechanics, and you need to know anatomy, of course, and you need to know practically every part of medical specialty, because we treat, as I said, everywhere. You treat the thoracic spine, so you need to know about lungs. You need the lumbar spine. We need to know about GI system. We treat the neck, so we need to know about spinal cord and vessels. And we need to know also about the skin, because most of our problems and surgeries occur under the skin. And last is the reason I mentioned before, is there's lack of mentorship. So in Lebanon, for example, in the Lebanese university, we don't have any females in the orthopedic department. In AUB, you don't have any orthopedic female surgeons. In LAU, you have one orthopedic female surgeon. In Kaslik University program, you don't have any. I don't know about Arabiya, but I doubt it very much. And in USG, there is none. So the lack of mentorship also discourages, because most of the questions I saw today is, can I succeed as an orthopedic surgeon in Lebanon? And if you all don't see a successful female orthopedic surgeon, you would think, well, if no one or very, very few were able to do it, how would I be able to do it? And that way of thinking is cautious, I agree. But I don't think that if someone else didn't do it, that means I won't be able to do it. For example, I was the first graduate from the Lebanese university to do any orthopedic training in the US. If I thought that no one would be able to do it, I don't need to apply, or I don't need to work hard because no one else did it, so why would I be able to do it? I was the first one graduating from orthopedic department of the Lebanese university to be a member of the Royal College in the UK, to go to Australia. And after me, many went, because, okay, then they saw there's someone. And it is hard to be the first. It's always hard to be the first. But doesn't mean that there is no first. And maybe the first is one of you. So in Lebanon, there are 3 female surgeons that I know of. I'm hoping I'm wrong, but there are 3. One is in the LAU, is Dr. Rima, and 2 others who are a graduate of the Lebanese University. Rima is not a graduate from Lebanon. So Rima studied and worked in the US as a hip surgeon and then came to Lebanon. The 2 others were female graduates from the Lebanese University orthopedic program. Diana that graduated, I think 10 years ago, and Farah graduated 2 years ago. And Rima is active on the academic circuit. She was, until last year, the head of the orthopedic residency program, and she's active in the lecture circuit. Diana and Farah are still Farah is fresh graduate, and Diana is still a junior attending. As far as residency program, there are also very few numbers. For example, the Lebanese University currently has no orthopedic female residents. LAU has one of our own graduates. So Marie Berberi is now a junior resident at the LAU program. She's also the only one. At the Kaslik program, there are no females. At AUB, I don't know how many are active now, but I suspect they're going to be at best if very, very few, so less than 5. If there's any. For example, at the neurosurgery program, I know at AUB there's 1. At the Lebanese University, there's none. So these 2 specialties have very limited female active residents, but I'm hoping that will change in the future. And the reason why is what I mentioned before. One, if there's fear for the future. So everyone, and this is not only for orthopedics, this applies for everyone. So I'm sure 10 years ago or 15 years ago, when the first female OBGYN resident graduated or applied to, because 20 years ago or 30 years ago, there were no female surgeons in any specialty. In the 1980s, there were none. In the 1920s, maybe a few number. So now, when you hear about a female general surgeon or a female OBGYN, that is no longer uncommon. When you hear about a female ENT or a female plastic, that is also not uncommon. So the change is going to come. But of course, some specialties are easier than other specialties. And this is not only in Lebanon, as you've seen the numbers, this is true for the US and for everywhere. But do not let the short term or what you see now, the image you see now, dictate what you think will happen in 10 years. The society is changing. 20 years ago, you probably would have been harder to get into medical school. Now it's probably the number of females is more than number of males. And of course, lack of interest. And lack of interest, as I said, came from lack of mentorship, came from orthopedics in general, is given little time in medical schools. So in medical school, they focus on mainly medical problems. So they want you to graduate knowing how to solve sodium and lungs and AO2 and cardiac rhythms and all that. There's very little emphasis on surgeries in general and orthopedic surgery in more. And I know a lot of students who apply to orthopedics having very, very little knowledge of it. And this for me is very bad, because how can you apply for something that is very demanding, 6 years of studying, and then a future in it, without actually being immersed in this field? Another problem I think that we face here more than elsewhere is that there are resistance from program directors. So program directors in Lebanon, most of them are male, if not all. In the US, as you saw, chairmen, there's only one. So they usually don't like female recruits in orthopedics. One, because a lot of male wrongly think, oh, she cannot handle the hours. When she gets pregnant, she's gonna take a maternity leave. If she has kids, that will affect on her work, because they assume that men don't need to be home. One, two, that women cannot do the hours that men do. And I hope that this way of thinking would have been beyond us into 2021, but there are a lot of surgeons, unfortunately, who still think that way. And lastly, the absence of national mentors in Lebanon or role models. So you don't see kind of key figures in orthopedic surgery in Lebanon that would say, oh, she is, or she has done, or she is, or she's the head of this, or she's the head of that. And I would hope, at least I doubt in the next 10 years, because there are no residents now. So probably it will take 10 years to have active orthopedic residents and graduates. But I know the change will come. And I kind of encourage you to not only think of the picture now, but think of the future. And medicine in Lebanon is difficult. Okay, medicine in Lebanon is difficult. We have very high numbers of doctors. We have very limited number of patients. So whether you're a male or female, you're going to have a lot of competition in any specialty. Even if you do GP or you do any specialty, a lot of questions I get is, what is the specialty that has the least number, or what is the specialty that I have the least competition? There is none. There is no specialty in Lebanon that is under-saturated. They're all oversaturated. And orthopedics is just one of them, okay? The good thing about orthopedics is that, as I said, it has a high variety. So for example, if you go in and you like to do small, fine, refined surgery, you can do hand. If you want to do spine, you can do spine. If you want to do sports, you can do sports. And if you want to do oncology, you can do oncology. By the way, Christy Weber, who was the head of AWS, isn't the typical pediatric orthopedic surgeon. She is an oncological orthopedic surgeon. So she treats tumors. So she's not one like, okay, she's probably pediatric orthopedic. No, she's not. So, and this motto for me is not only for girls, it's for everyone, is push the limits others set for you. Do not accept to be limited what other people tell you you can or cannot do. This is true for everyone. For Lebanese university graduates, do not listen, you're the LU graduate, or you probably won't be able to do this. You're probably a girl, you probably won't be able to do that. Or you're of this race, or this nationality, or this religion. Do not accept these limits, and always try to push. And you see that once you push and once you work hard at it, it is not as hard as you imagined. And believe me, the benefits and the goal that you achieve will be worth all the trouble. Okay, so now we'll be open for questions. If anyone has any questions in particular, you can send them through the chat. And so Zainab asked, even if women applying for a residency had the highest competitive grades, men are still chosen. Yes, unfortunately it is. Because in Lebanon, one of the benefits of religion, of sectarianism actually, is that applicants for residency programs does not involve an interview. So for example, in the Lebanese university, because there's always a fear that this religion or that religion, this head of a program is pro this religion or is towards this political group, that he would choose his own people. So in the LU residency program, it's based on grades. So if you are number one, you can choose whatever you want. Number two, you can choose whatever you want, regardless of gender, of religion, of political affiliation. Other programs in Lebanon are based upon, and the US and everywhere else, is based mainly upon interview, because I think this is essential. I think the LU program has that problem, because you don't get to see who's recruiting, because we get residents, and male or female, males for now that are, from my point of view, not suitable to be an orthopedic surgeon. They can be brilliant as something else, but not in orthopedics. So unfortunately, programs who might have interviews where the interview has a lot of weight on the decision, yes, some program directors, some chairmen are not pro towards getting female recruits. How hard did you work to get matched in the US residency? So I didn't match with the residency itself. So I went at the postgraduate program. I stayed there a few years, but I went to France first, and it's not easy. So after Lebanon, I went to France. After France, I went to the US. After US, I went to the UK, and then I went to Australia. So, and until there, I did a lot of work. So in Lebanon and there, I helped a lot of people, and I worked a lot in Lebanon. So when you work and when you are I'm not gonna toot my own horn, but when you are very good at what you do, people will vouch for you. And still, medicine, like any other job, if you're applying and you get a good reference, because when you apply to a program, any program in Lebanon, in the US, you are an unknown. For example, when Dr. Marie Berberi applied for the LAU, they didn't know her. They knew me, and I knew Marie. So I vouched for Marie. I told them Marie is an excellent resident, and she will make an excellent orthopedic resident. So, and that's what you need for everyone. So, I suggest you start this in medical school. So in medical school, when you are very good in school, you move that into internship residency, then you'll get someone to vouch for you with that program, because that program, for you, for it, you're an unknown entity. And if they know someone, that would be a lot better than even with better grades. On what would a medical student focus during his or her medical years to research to ensure getting into orthopedics, especially for females? So there is nothing called especially for females. So one, let's say for everyone. Orthopedics is very competitive. So in order for you to get into a program, whether in Lebanon or elsewhere, you need to get high grades. In Lebanon, in order to ensure getting into orthopedics, you need to be in the top 20 in the Lebanese program. At AUB or LAU or other programs, you need very high grades. If you've done, for example, the entrance exams to AUB, you need high grades as well. If you've done your step 1 to your USMLE, if you're getting high grades, if you've done research, it's better. As I said, in the Lebanese university, is based on rank. So if you're good at school, you go in. In other places, you need by dossier. So you need to have many things. You need to have a good background, good reference letters, articles, research. They need to see you, and when they look at you, they need to see this person is enthusiastic, hard worker, honest, can be a role model for other years, because when you're in an orthopedic program, it's 5 to 6 years. So they're gonna live with you for 6 years. It's like a marriage, and it's probably longer than a lot of marriages. And you don't marry someone you don't know. And this someone eventually is gonna be chief. So they're gonna be the role model for younger residents. So they want someone not only to be a good resident, but also to be a good chief resident. You mentioned stats related to females signing up for orthopedic residency program. Do we know how comparable these stats are to, let's say, other competitive surgical facilities, cardiothoracic neurosurgery in Lebanon or abroad? Yes. So in Lebanon, for example, orthopedics, I haven't heard of any in Lebanese university of any female wanting to apply and they couldn't get in. Okay. In cardiothoracic and, for example, neurosurgery, there haven't been any applicants. In general surgery, there have been a lot. So, for example, in the Lebanese university, you have at least 1 or 2 per year female residents. At AUB, the same. So at least 1 or 2 per year are female residents in general surgery. In obstetrics, nearly half of applicants and residents are female. So, and this is true for US. So in the US, 50% of female residents are female. Do you feel Muslim people looking for residencies face a certain prejudice in the US? Honestly, no. Okay. Although there's a stigma on Muslims, but a lot of my friends who went to the US are Muslims. And for example, my graduate year, so in the Lebanese University, so I graduated in the early 2000s. Of the 80 students that we were, only the remaining in Lebanon are 73. And so everyone was there, Muslim and non-Muslim. But if you do good grades, and the US, honestly, unless you go to West Virginia or like middle of Texas, they don't see race. They see a person. If you're a good person and you work well, they don't see which God you pray to. 9/11 is way old, man. It's way beyond now. So no, don't. Having American doctors as relatives in the US, can I benefit from this? Yes, because as I said, you have contacts. And if someone spoke that, for example, this person is not an unknown entity, we know this person is not a psychopath, he's not gonna like kill you, and he's a hard worker. That's most of what these program directors want. And if you have good grades and good research, that's most of what they need. But again, they won't prioritize a foreigner over a national. So let's say you're applying for the residency program in the University of Pennsylvania. And at UPenn, you have 10 medical students who are applying for one residency program, their own medical students that they've rounded with and rotated with, and they know for the entire medical school. And then comes one person, female or male, from outside of the US, I'm not saying Lebanon, outside of the US. Even if someone speaks highly of you, they won't prioritize you over their own. If none of their own is applying, then yes, they would choose one from outside. Again, one from outside UPenn. It could be from Chicago or another state. But if they have an excellent person from an international medical graduate, so an IMG, then they might consider. Again, this is not easy. As I said, 450 in the US apply for one spot. So it's very hard for you to come from outside and apply. One of the ways to do that is to go into research. I know a lot of people that I know went and did 1 year, 2 years, even 3 years of research in order to then become a known entity. Then when they apply for the program, you're no longer the IMG. You're pretty much the kid in the or the student of the university, and now you're nearly as at the same footing as other students. Did we miss any questions? Right, I think that's it. All right, if there's no more questions, I hope you all kind of got a bit of encouragement. And again, any specialty you want, any specialty you want to do, I suggest you push for it, whether it's orthopedics, it's neurosurgery, it's whatever you want, okay? I suggest you push for it. And because that is the most sure way of succeeding, is getting into a specialty that you love, because that will make, so there's a very corny proverb. If you love what you're doing, it's no longer a job. Okay, so I suggest you do that, because you're going to be doing this hopefully for 40 years, because most surgeons, they stop work at 70. So if you graduate at 30, you're going to have 40 years of doing that specialty. If you don't love it, it's going to be very hard 40 years. Okay.
Okay, thank you so much for your time, doctor.
Most welcome, and good luck to you all.
يعطيك العافية.
يعطيك العافية دكتور.
Thank you, doctor.
Thank you.